Good morning or afternoon, everyone. Thank you for joining us for today's webinar. Today, we'll be having a panel discussion on the successes and challenges of coordinating across sectors to enhance preparedness in response to environmental health disasters. My name is Amy Chang, a senior program analyst here at NEHA, National Environmental Health Association. The agenda for today's webinar has 4 panelists who are going to share best practices and strategies for overcoming the challenges of coordinating across sectors to enhance preparedness and response to environmental health disasters. The panel discussion will then be followed by a Q&A session. Please note that the webinar is being recorded and the webinar recording will be uploaded to the NEHA website. Everyone is muted, but we do encourage discussion in the chat box. Also, questions will be asked at the end of the panel, but please feel free to drop your questions in the Q&A box throughout the discussions. At the conclusion of the webinar, you'll be asked to complete a short evaluation. Please complete that as we would really appreciate your feedback. We will now welcome Dr. David Dijak, Executive Director of NEHA, to give a brief background on NEHA's work in preparedness. Dr. Dijak?
Yeah, thank you, Amy. You know, it seems almost like yesterday. I was early in my career and I'd put in a long week in Binghamton, New York, and I was driving home on a Sunday night in my Dodge 024, and I got all the way from New York to the Key Bridge in Baltimore when that check engine light came on. But you know what, Amy? I just kept right on driving until I got to my apartment in Annapolis, Maryland. And I recall walking up the steps and going into the door. And I wasn't home 10 minutes when the phone rang. And for most of you folks my age, you'll chuckle when you hear this. I had a landline and I wasn't important enough to have a beeper. So when the landline rang, you didn't know who it was. And after a couple of rings, at this time it was like 11 p.m., I answered it. And it was my boss. I worked in the private sector. Would I go into Washington, D.C. to the Chesapeake and Potomac Telephone Company because they had just evacuated a building of operators back when you used to dial 0 to talk to somebody because of carbon monoxide exposure? I was exhausted, but went there. And what I immediately found was cognitive dissonance. We were asked to set up a carbon monoxide surveillance program in the building after it had been evacuated. And what I saw, the occupants were what appeared to me to be 100% female, many in late-term pregnancy, some approaching the age of 70, as far as I could tell. They were frightened and agitated. And here I was, as an environmental health specialist, asked to put together a surveillance program to ensure that they would not be overexposed to carbon monoxide if it returned. The personal exposure limit or permissible exposure limit under OSHA was 50 parts per million, 50. And what I know is that carbon monoxide has a 200 times greater affinity for hemoglobin than oxygen. What this means is the OSHA standard for construction and industry was not appropriate for the indoor environment for sensitive populations that I just described. And on the spot and in consultation with my boss, we developed a 1/10 protocol. That is, if the carbon monoxide got to 1/10 of the PEL, or 5 parts per million, we would take action. And you know, it never did go over 5, and we did find the source of the carbon monoxide, but I'll tell that story on another day. You know, Mark Twain once said, history doesn't repeat itself, but it certainly rhymes. And if you think about cognitive dissonance, think about the drought and flood cycles that the country's going through, the wildfire and reoccupancy. Is my home safe to reoccupy? The wildfires and personal protective equipment for the general public, N95 respirators, should they wear it? I got a call the other day about Corsi Rosenthal boxes, and should people put those in their homes? What about dis and misinformation? Tropical storm Ophelia, that's still kicking around, and the destruction to businesses. Should there be some type of reoccupancy standard for businesses that have been flooded? And then, of course, the entire universe of One Health and zoonotic diseases, COVID, and others that affect environmental health. To be clear, NEHA is deeply steeped in this next generation of questions regarding environmental health. It's not just carbon monoxide in an office building in Washington, D.C., but it is providing policy and technical leadership to the profession in this era of uncertainty. Think about it. Until recently, our profession was largely involved in code enforcement, but not anymore. More and more frequently, our profession are the chief science officers in disaster response and recovery efforts. NEHA was actively involved in advocating for an updated PAPA legislation, the Pandemic and All Hazards Preparedness Act, in 2019. Prior to 2019, environmental health was not mentioned in the PAPA legislation. We were able to work with the Senate Health Committee, and the current version of PAPA has environmental health listed 8 times. We asked the ASPR, the Assistant Secretary for Preparedness and Emergency Response, Dr. Kadlec at that time, to be a keynote speaker at our conference, and he did that. We provide training in collaboration with the Food and Drug Administration around temporary food establishments. We are delighted to work with CDC, NCEH, ATSDR around concurrent disasters. We just completed a training out in the far Pacific in Palau around the emergency environmental health training and emergency response. Our leadership program brings our emerging leaders in environmental health to the FEMA training site in Anniston, Alabama. And what you see on the slide in front of you are examples of the technical documents that our team is working on to ensure that environmental health practitioners know what they need to know when they need to know it. Amy, I could go on, but I hope this kind of gives you some sense of the energy and the direction that NEHA is taking moving into the future. We understand that this is a time of cognitive dissonance. We're often not funded to participate in emergency preparedness and response, but lo and behold, with increasing requests, we are active participants and contributors escorting society back to a health and safety normal working environment, and we're delighted to play that role. With that, I'll turn it back over to Amy. Thank you, everyone, for joining this afternoon, and I look forward to working with each and every one of you as we advance the environmental health profession and its rightful role in response, recovery, and resiliency. Amy?
Thank you, Dr. Dijak. We'll now introduce our panelists. So our panelists include Captain J. Christopher Yee, a Senior Emergency Response Coordinator at the Office of Import Operations at the U.S. Food and Drug Administration. Kelly Dipalt, the Division Director with EPA's Center for Environmental Solutions and Emergency Response at the Technical Support Coordination Division. Megan Floyd, Supervising Environmental Specialist within the Environmental Compliance Division, the Water Protection Program in Sacramento County, California. And Sada Yorbati, Chief of the Environmental Health Division at the Support Selection Center for EH at the California Department of Health. Their brief bios are available in the webinar chat box. With that, please welcome the moderator for today's webinar, Kai Algathon, the Region 8 Director at the Office of Community Health and Hazard Assessment, Agency for Toxic Substances and Disease Registry. Kai, I'll turn it over to you to moderate.
Hi, good morning, good afternoon, everyone, and thank you very much for joining this webinar. This is an effort that goes back to the middle of last year. Sada Yorbati, as my co-chair and me as the chair of the NEHA Preparedness Committee, we started up this conversation about how to coordinate across sectors. What do we know? What do we not know? And what issues have we had, and how do we think we can solve those? And so, most recently, the new issue of the journal. We also have a column in there this month that covers these same issues, and I think it's really grown into a great discussion over the last year and a half. So I'm really excited to be able to welcome folks to talk about this a little more today. So please keep putting questions in the chat. Please use the box throughout, and we will triage the questions and make sure that they all get addressed at the end of the Q&A. So please participate as much as possible. Also, we'll have time for some verbal questions as well at the end. But let's start off right now talking through our questions here for the panel. And I'm going to start with this first question and pose it first to Sada. So information sharing and cooperative action across sectors is essential for enhanced preparedness and response to EPH threats. What are some of the challenges in fostering mutual commitment to information sharing through trusted partnerships that you have or have had?
Good morning, everyone. Thank you, Kai. Two things that I would like to highlight. I'd say the first one being communicating the role of environmental health in disaster management. And the second one for sure is resource allocation for local environmental health. And I stress local environmental health because they are on the front lines of delivering environmental public health and have to balance both environmental protection at large and overall, as well as health and safety codes. So they have a lot to handle. And in terms of coming back to communication, there are so many facets of environmental health, as we are all abundantly aware of. And communicating that to decision makers primarily and other partner agencies and entities, as well as public health. The fact that it's regulatory, but much more than regulatory. We have epi surveillance and monitoring. We have laboratory capability, all these different areas that fall under environmental health. But primarily, I would say communicating, how do we communicate? You can see I'm struggling right now. The fact that environmental health is about protecting those critical life-sustaining factors that can kill or maim people very, very quickly. Food, water, air, all of these things being safe and continuing to be safe, and how we need to mobilize our entire workforce and our operational structures, modifying them to adapt in a disaster situation. Communicating that has always been challenging. And of course, resource prioritization for local environmental health. We know that most local environmental health do not receive preparedness funds, and they operate on a fee-for-service model on a routine basis, and they're suddenly expected to switch gears and take on response and recovery, when in many cases EOCs are shut down and former chains of communication aren't happening as they usually do. So everything falls in to that entire, supporting that system will not be possible if they don't get preparedness funding and they're not integrated into planning activities of all kinds.
Thank you very much, Sada. If we can go to Captain Yi, same question.
Hi, everybody. If you could see me. I just do want to echo what Sada said about changing gears, which is a bureaucratic shock in which all the activities are geared to one thing versus our routine activities. But I do want to say that, at least in my experience, phone calls and at least keeping updated each other with familiar change, how do I say this? Being familiar with the constant changes within our respective sister agencies helps out a lot in terms of what rules and regulations that are constantly changing we work under, the essential elements of information during an activity or emergency response that we need, as well as some of the other bureaucratic constraints during the downtime. It doesn't take money for that to happen. it may even be a little bit nosy, like during a symposium or whatever, saying, "What do you guys got going right now?" Or are there any changes for your information sharing for regulatory agencies? I'm going to put on my FDA hat right now and say that as a public health and regulatory agency, we do have substantial information sharing laws that bind us from disclosing a lot of information, and getting that stuff out of the way, which does not take money, can be done to grease the wheels should something happen. And later on, as I look at the questions later on, I can go more in depth on things that don't cost money, just a little bit of time, so that that learning curve, up to date learning curve, because since all of our agencies evolve over time, people come, people go, changes in bureaucratic posture and things like that change, and we need to be updating each other on the latest.
Thank you very much. And we are on question 1 right now, if you've just joined us. And I'd like to pose the same question to Kelly.
Hey everyone, glad to join today. I think a lot of what has been said, I would agree with so far. I think communication and relationship building is vastly important to have ahead of a disaster or an incident, and kind of understanding each agency's roles and focus for the disaster. A lot of times EPA, when we first come in, we're very concerned with obviously first protecting public health, but also starting to look at the environmental cleanup and data collection, and understanding and having a mutual understanding of sometimes there's a lot of limitations within what we know in the beginning, and that the situation is going to change over time. But I think having those relationships and understanding each sector's roles and kind of pieces to the puzzle to work together to solve it is, at the foremost. I think from EPA's perspective, we rely on a lot of the other public health organizations, local and federal, to kind of do the public health communication and protection. And so it's how do we understand what I guess information that we can provide and what we need back. So I think having those relationships up front is what's really kind of important.
Great, thank you. And question 1 to you, Megan.
Good morning, everyone. I would agree, and just, with what everybody else has said, the relationship building ahead of time, there may be resources that, SAUDA or the EPA have that I don't, but also being local, I've built relationships with some of the regulated community. And so there may be resources that I know just on a communication with those frontline people and those people that are in the disaster and affected that they may not know. So I agree that just having these types of meetings and conversations ahead of time is really important.
That's excellent. Thank you all very much. Moving on to question 2. Can you all share some examples of what has worked to facilitate sharing of critical information and resources across sectors? And back to you, Sada.
I would say definitely, I'm sorry, I'm having trouble starting my camera up again. So the EDER training has been an excellent format for relationship building and communication, because it allows us not only to follow a framework that touches on all areas of environmental health in disasters, but it also allows us to bring in partners. We bring in all partner agencies, local through federal. We brought in World Central Kitchen. So we have occasionally some community and private sector partners as well, the Red Cross. And we are able to cross-train each other and have an honest dialogue of how we do things here at home. So it's tailored to jurisdictions within our state whenever possible. And we also have an intro level that's very high level, where it's an 8-hour course. So that has been phenomenally useful, as well as encouraging people to go over to Alabama to get the full ops training. Thanks, Guy. I'll hand it back to you.
It looks like Kai may have dropped off. Maybe there's something wrong with his connection. Let's move on to the second question to Megan. Same question. Kai, you're back, but I just moved on to the question to Megan.
Thank you, Amy.
So again, the EDDR training, the one that's in Alabama, I went in 2019, and I agree completely with what everybody's saying, that hands-on training and just seeing firsthand, even though they're actors, situations that can go awry, was invaluable. So I really, really highly recommend that training, and just the fact that it's basically free for, people, counties to send their employees, or jurisdictions to send their employees, is really, it's one of a kind. So I highly recommend taking that, and you build those relationships, and you get to see what worked for other people and what worked for you. And it's something to learn from. You can always learn from yourself mistakes. You can always learn from others' mistakes or things they would have done differently. So the debriefing and the hot washes, I feel, are also invaluable.
Thank you. And did Kelly get a chance to comment on question 2?
One second, sorry, my mouse was being challenging. So I took this question, I looked at it kind of in a different perspective. I was looking at during an incident, critical information and resource sharing during an event. And really, I think, most large responses are working under the unified command and bringing in all partnership. I think trying to have public health specific unit calls and check-ins frequently with kind of all levels there, whether it's local, state, and federal, all kind of talking through the most critical issues and sharing what's new coming out of the incident. So everybody's kind of on the same playing field. I think trying to use as many, we have a lot of great technology with sharing data and sharing information, and just trying to collaborate kind of in one space and kind of that one health realm, I think is really important for us moving forward.
Thank you. And Captain Yi, did you get a chance to address question 2?
Yes, thanks, Kai.
Okay. Good.
Just as was mentioned just previously, I read this question slightly different as an information and resource sharing during a response. And I just did want to say that even though I said a lot can be done without resources, monies involved, as mentioned before, tech platforms such as Microsoft Teams, Web EOC, does greatly enhance connectivity and sharing information that can't be done verbally, or at least in an email chain, which we all know can go awry with a myth and things of that nature. But in the FDA realm, at least, our Office of Partnerships has invested in Food Shield, which is a document sharing platform, and there are others as well, so that more data can be shared between different agencies. Because in the older days, we were sharing jump drives like poker chips during foodborne outbreaks and things like that between us feds and, let's say, California Department of Public Health in the older days and things like that. So yes, monies towards something like that can grease the wheels, but other things jurisdiction-wise, such as MOUs and things like that, can grease the wheels ahead of time and not cost money, but just take time, and our regulatory or compliance officers can work so that that information can go freely, such as when we did an incident where there was show horses that were being poisoned with botulinum and things like that. We were working with universities and other multiple states, and yet we had to at the last minute do MOUs with that so we could keep that information secure, so we can share traceback information better and lab results better, so we could more quickly get a firm to recall and stop an incident from expanding. So there are some things that can be done without money, but of course, Zoom, Microsoft Teams, and other things like that greatly enhance our response.
Thank you all very much. Question 3, what are some barriers that can impede coordination across sectors? And what are some of the specific barriers that you faced or are facing now in responding to emergencies? And let's go back to you, Sada.
Governance structures for sure across the board. Just the fact that doesn't always have to be in public health. Sometimes it's completely outside the health department. And I know this is happening in all states. So while FEMA counts environmental health as ESF8, we all understand why, I totally agree. In terms of when a disaster strikes and people are trying to obtain mutual aid, even do needs assessment, and acquire resources, and ultimately get reimbursement for those resources, it just complicates the whole, I think, response and recovery, because of the way that routine operations are carried out. I would say that is one of the biggest barriers. Another big barrier and a challenge, of course, is the workforce, environmental health workforce, but just not getting enough people coming into the profession. And then we have huge attrition rate through retirement.
Great. To you, Captain Yi.
I would say that, of course, training would lower the learning curve, because during stand-up, when we initially respond to an incident, knowing who are the main players, the points of contact, and making sure that those people around you are at the same level of understanding of ICS and other things like that, make a huge difference. And it makes a difference between days to maybe a week. So making sure that the people around you that you're working with are empowered to make the decisions and be trained up at the same level as, let's say, ICS and other response assets, goes a long, long way. And the recognition, actually, that emergency managers, as a profession within each jurisdiction, does help, because sometimes during COVID, a lot of people were sent towards EOCs, but yet they weren't empowered to make the right decisions, and they have to get back to the decision makers as a liaison. And unfortunately, that doesn't happen, which leads to a little bit of a delay.
How about the EPA perspective, Kelly?
So I would agree with what was just said. I think having decision makers and individuals working under unified command empowered to make decisions and to share those decisions. I think, we do across our different agencies often need to get another decision makers or run it up kind of our chain before something gets put out there. I think having everyone within that unified command operating and trained up to make those decisions could help a lot. I think the other thing is a lot of the media. I think in some recent disasters that have occurred, the social media aspect plays a huge role. And this may be a little off focus for this talk, but I think it's something that we need to look for going forward with. Some of the barriers is information getting put out there that is not necessarily what public health sector would put out and would agree to, but it's making it to the public faster than probably some of the messages coming out of the actual incident command are. And something moving forward we may want to consider spending more effort looking into.
And Megan, what about the local perspective on barriers?
Retention is obviously an issue with people retiring and a younger generation coming in, and just that that generational gap of how to make things different and how to work differently in those scenarios, especially for a younger generation that hasn't been exposed to any type of disaster, such as, a natural disaster like a flood, or earthquake, a fire, anything like that. Where I'm in California, so wildfires is, per usual every year, but a lack of training in those regards when it comes to a real-time situation. We can prepare and tabletop all we want, but until we're really in the thick of the event, I think theoretically what we think want to happen and what actually does happen are sometimes very different things. So understanding you do have to be adaptable in certain situations, and what's on paper might not what may transpire throughout the event, and just being flexible and adaptable to that.
Great. Going back to you, Sada, talking about existing resources, what do we have already that can be easily leveraged to increase coordination?
That is an important point, and I do thank Chris for really specifically emphasizing that there are definitely a lot of resources available, and it's not always about funding limitations. So that would be, for instance, existing emergency management systems and protocols that environmental health can certainly integrate into, as well as Homeland Security funding. And I know that in every jurisdiction, it's going to be done a little bit differently, but there are partners that, in our case, for instance, our National Guard, the civil support teams, they do every single year, they have a number of multi-agency exercises, and there's a huge environmental science component into it. So once we do work with relationship building, of course. So we go out and exercise with them, and we are able to add our own objectives into the whole play, and able to do everything from notification all the way through producing guidance if we wanted to, lab testing, whatever it is that we want to exercise. So that is one of a lot of partner resources are available, but again, it depends on, do you have dedicated staff to work on tapping into those resources or not?
Captain Yi, from the Public Health Service and FDA side, what existing resources can you identify?
Well, thanks, Guy. I put in the chat, one of the things that FDA does, at least, is called the freebie. It's a canned set of exercises, the different scenarios from intentional contamination to natural disasters, and it specs out and everything in one package, all the way down to the table tents to put names on. And it has the scenarios and has um, a list of actions that can be done, and does a lot of the planning for you. So that's just one thing on the FDA side, do, and it's free to anybody. So feel free to just take a look at it and shamelessly rip off of it to help your own exercises and preparedness needs. Now, for the PHS side of things, um, we have a ready workforce, and actually we should emphasize ICS more. But because of the variety of things that PHS does, it's hard to prepare for everything since our mission is so broad. But all our officers are trained in ICS, the basics. But whether it's from COVID or doing clinics, all the way to unaccompanied minor missions, it's a lot, and everything in between. So public health wise, it is hard to for me to identify the specific resources that we've got. But on the FDA side, I could at least give something palpable to everybody in this audience that you could shamelessly rip off, slap your name on it, and look good to your bosses, so that we can grease the wheels and get exercise going. And then just real quick, what we also had is learning from our mistakes. In terms of, there was a food outbreak for Salmonella puna in cucumbers in 2016, and we were working with DoD, and they had different missions, different priorities than the FDA does, and so the information flow was not happening as much as we were used to. So what we did do was an after action review right after that, and we did a tabletop exercise that was slightly tweaked, and we did it again. And now that things were calmer and slower, we're able to identify each other's limitations on information sharing, because they have force readiness protection and things like that that the FDA does not have, and just slightly different. And we were able to identify that. So all I'm saying is, if time permits, if you do an after action and recreate with little tweaks a scenario for training, maybe we could flesh out so we could do better next time. Thanks, Guy.
Thank you. Kelly, what existing resources does EPA have, either along the lines of what FDA has or something else that you could point us to?
So I'm struggling a little bit with this one. I do think we at EPA do a lot of training exercises, ICS training, but really focused on responding to the initial emergency and possibly not as much looking at the public health side of that. With our exercises, I do encourage any local health departments to reach out to their regional EPA and try and get involved in some of those exercises. And those go from full-scale events to tabletop exercises as well. I would agree with the after action reports and looking at those. Recently, you know, we've been heavily engaged in Region 5 in the East Palestine incident that has had a lot of, I think, we'll have a lot of lessons learned looking at the public health side of it and messaging. And there's probably going to be some activities coming out of that where we look back on how could we do things differently. I think there's definitely been improvements that I have seen being part of the public health unit as that incident has gone over. But it'll go back to kind of what I said, the more relationship building we have in the beginning and trying to make the connections. I don't really have good resources that are available, but making those connections and building those relationships really help with the preparedness and the response efforts. So not only public health sector knows who to call, but EPA knows who to reach out from the local perspective to make sure everyone's engaged from the beginning.
Yeah, and I would just throw out that it's possible to be a part of the regional response teams that address ESFs, and that's a great way for. I'm a part of the RRT in Region 8, and that's a great way that we interact with EPA and with Coast Guard and NOAA and all those entities. So if you're not already engaged with your local RRT, I would recommend reaching out or reach back to me, and I can try to help connect you with that as well. Megan, local perspective, what resources do you have that maybe other people don't have at that level?
So being at the local level, what we have that relationship that's built with the regulated communities or the impacted communities, whether it be a fire again, a flood, an earthquake. We have those relationships because we're the ones that they see. We're the ones going into restaurants. We're the ones looking at wells and hazardous materials and hazardous wastes. So we have that rapport that somebody from the EPA or the state might not have. And we've spent years building that rapport with them. So we may lack some of the funding, obviously at local levels, but we do have those relationships built. And so for the state or the EPA to utilize us to kind of be that liaison, I think makes it a little less intimidating for those larger agencies to come into the community that's impacted.
Yeah, I think that really makes the point that all emergencies are local, and having that point of contact through the locals is critical for us all to be successful. Sada, I see you have a hand up.
Yeah, so in terms of regional response teams as well, I just wanted to say that your local emergency planning committee that the EPA, of course, supports and helps to run, these are everywhere, and it's an excellent way to get acquainted with all your response partners and work on that relationship building. And they will have trainings, exercises, information and funding sources, and much more. So that's another one to look into.
Yeah, thank you very much for pointing that out. And while you're on camera, let's go to you for question 5, which is, are there existing gaps in funding tools and or training for environmental public health professionals that impact the ability for a more coordinated emergency preparedness and response. So what are the gaps that are most striking?
The gaps, definitely, I think many people, including Dr. Dijak, have pointed out in the chat. Gaps for sure. I think specific language in what we currently have, FEP guidance that largely is diverted towards ESF8 preparedness. It's very difficult for decision makers who are primarily FEP program managers to interpret current language into actionable items that can then be infused into work plans. And that filters through, or it manifests in multiple different ways, whether you're exercising or working on interagency plans, state level, local level, doesn't really matter. It tends to manifest in multiple different ways. So basically tools and systems. If that can somehow be fixed, I think that will go a long way. But again, really another major gap goes back to this whole governance structure of environmental health. So anything I think environmental public health leadership can do in terms of promoting preparedness, and recognizing that with climate change, no one is going to be immune. Maybe your jurisdiction has not experienced any major catastrophic disaster in the recent future, but it's coming. Something is going to be headed your way for sure. So just having that mindset and proactively working towards relationship building and preparedness, I think, will be critical in bridging that gap.
Great, thanks. So over to Captain Yi and FDA, what are the gaps that you see?
Yeah, hi. Thanks, Kai. I'm going to have to say the awareness of training opportunities, as well as dedicating time for your staff to participate in trainings. That's where the rubber meets the road, quite frankly. Not only to know what are the limitations of the other agencies that you're working with, but also learning a little bit more about the context of an ESF8 level event. I used to be a liaison officer for our risk team for Region 9 in the ESF8. And the great thing about being in the middle as liaison officer, you can see what's going on above and below and sideways to our sister agencies. And that's a great viewpoint. So, and what I do see is it's hard to free up staff from your regular work plan, work day to do these kind of things. But as was noted before, climate change isn't going away. The number and frequency of natural disasters, as well as complicated by national level exercises or national special security events, are happening all the time, whether it's a Super Bowl in your backyard or a earthquake or a wildfire. So the more familiar we are with each other, the better. As a liaison officer, I used to see the same people over and over again, and I leveraged that familiarity with people into something during the downtime, what I call it. So the preparedness is that much smoother. And that's the biggest gap that I can see.
That's great, thanks. What about the EPA perspective on gaps in funding, tools, or training?
So I would say, I think, finding time to do the training and the relationship building and the outreach. I think we are all very busy on dealing with our day-to-day or other responses that we don't always make the space for that. So reaching out more to build those relationships is important. I also was mentioned earlier about just kind of an aging workforce and experience. I know when I look across EPA, we have a lot of senior folks that are able to or will be retiring. So how do we also get new folks up to speed and trained up for dealing with the next round of emergencies? Also coming from so I sit in the Office of Research and Development, so we get tasked with all the kind of unknown questions. And, one of our struggles is being very nimble in our research to address those questions that come up and need to be answered right away, where normally, it may take months to years, and we need to do it in days to weeks. So, I think looking at what do we see coming in the future and emerging as far as needs and gaps is important, and then how do we address those?
Thank you. And Megan, the local perspective on gaps, funding tools, or training, what do you see?
So again, funding is obviously probably a little more locally impacted since we are out there on the front lines. And then if there is some sort of natural disaster and it's been declared that way, then it does go for reimbursement. But also what I see is there's a lot of technology available. And I don't feel like we all utilize similar ones. So using Microsoft Teams versus versus Zoom, even just having a brief familiarity with whatever platform you're going to use to be able to communicate and or train and or do GIS mapping or anything like that, I feel can make a situation either a lot more challenging or a lot easier to deal with if the person is familiar with those tools and technology available. And at the local level, we don't have access to some of that stuff that either the EPA, FTA, or the state has. So that can be a challenge at times.
Yeah, absolutely. That was one of the most frequently mentioned issues that came up in the column that we just put out when we polled people. That was really a big one that everyone flagged, was just trying to speak the same language by having the same technology is really a challenge, and that can be easier for the feds than for states and for local. So yeah, absolutely. And I want to point out again, if you have questions, I think some of the questions that people have been posing are in the chat. Also put questions in the Q&A. So there's two different tabs at the bottom there. If you can put your questions in the Q&A, if you've already put it in the chat, if you don't mind putting it in the Q&A too, it'll probably make it easier for us to go through those when we get to the end here. So moving on to then the last question, coming back around first to SADA at the state level, can you share examples of successful cross-sector collaboration in emergency preparedness and response?
I have to go back to California EDR training again, customized county, customized trainings. We have one that we're planning with Megan and Sac County in January. So again, it's an excellent format to bring in local, state, national partners to the table, cross-train each other, and really get that conversation going. And every single time we find that people are usually surprised. Other agencies will come in and they get to learn about environmental health in all its facets, and vice versa. And you get everybody from that new trainee all the way to your highest levels of leadership, all in the same room. The local county decision makers from all the different agencies are in the same room. So I strongly advocate we have a framework figured out. People are welcome, very welcome to contact us, and we'll share what we have. You can use our contact. We'll send you our entire slide decks and show you how we do it here. So that's something that has worked really well. And I will say, in fact, another successful cross-sector collaboration would be, we are at the state level, our Fish and Wildlife has just started standing up an interagency public health assessment unit. And this came from an oil spill that happened last year in Southern California, when public health was integrated into the formal incident command structure at the county level. And they realized that we really need to do this on a regular basis, make sure all environmental and public health are always part of the IC. And we're working on it. We're building specifically for oil spills and other hazmat releases into water. is what we're working on, and hopefully we'll be able to expand that to other areas as well.
That's great, thanks. And I'm hearing a theme of several different free resources that are being offered here. So definitely be sure to follow up. We'll make sure to have a summary of that as well at the end of this session today. But there's some great both examples and resources being put out here. So examples going over now to Captain Yi and FDA or PHS.
One of the things I was most proud of actually came from a simple phone call. When the FDA decided to do swabbing as part of our inspections, and there was a lack of 3M spongicles for swabbing surfaces to detect if there's salmonella or listeria or other things on surfaces. Across the country, everybody was asking for it because that was going to be routine. And California Department of Public Health Food and Drug Branch says, "Hey, can we borrow some of yours as long as it's the same model and brand, and we'll pay. We'll give you back when our order comes through." And we, the FDA, we said, "Sure, not a problem." We exchanged supplies to help each other out in the meantime, and our labs have in the past helped each other out when there's a shortage on materials for the lab if we happen to be short should something happen. And I'm very proud of that because for the longest time we would do a lot of endeavors, and I'm guessing from the EPA environmental perspective, you have rapid response teams and things like that. CalFIRT was a California Food Emergency Response Team, which is part fed, part state. We've been operating for over 15 years, and there wasn't for the longest time, about 5 years, not a single line item in anybody's budget that said CalFIRT. It took political will and internally a little bit of money to travel people to meet and talk and work out how we were going to work. Fed and state were supposed to work together, and we did that with minimal fuss muss in terms of coordination and monies, because it took political will to say, yes, we should work together, because it was ridiculous to be knocking on doors with the same questions and asking for the same paperwork for a foodborne outbreak. And so a lot can be done without some monies, but the sharing of resources like that freely is one of the things I'm most proud of, and I've seen cross-sector wise before and during an emergency.
Very good, thank you. What about from the EPA side? What are some successes for collaboration or sharing?
Well, I could give a handful of examples, but I just kind of want to point out, so there are many different arms of EPA. I think probably most local agencies are used to working with their regional offices, but we do have our emergency response team. We have mobile assets that can come in and help. But within the Office of Research and Development, again, we have a lot of national experts that can come in and help with, doesn't have to be a huge environmental or emergency response situation or a natural disaster, but we do have experts and resources that can come in without funding or other resources needing to be put in, but we can come in and help solve issues. For example, a few years ago in some of the California wildfires, there was concern about specific chemicals from water distribution systems coming in and what the potential impacts were. And we had a group of researchers that were doing similar lines of research and then could provide back some things to consider, some decontamination methods that the local entities could utilize to protect water quality in the area. So I think, we can help on very large things, but also we do have expertise that isn't well known that any local state agency can tap into.
That's great. And what about from the local perspective, Megan? Examples of successes with collaboration or partnerships?
So I've worked with SALDA multiple times. I've taught the EDR training multiple times, mainly for drinking water and wastewater, but I'm also a certified water treatment operator through the State Water Resources Control Board. And when we had flooding and we're taking water samples, it was on me to train our environmental health staff. And so what I did is I actually made about a 30-second video of how to do it properly. And I've shared that at multiple EDR trainings, and it has been used up and down the state, this quick little 30 or 40-second video I did. So sometimes using just simple little tools like that, because I can talk to people all day, but when they watch a video, it has a different impact on people. That yes, here I'm standing talking in front of a classroom, but I'm also in the field doing stuff. And I think saying one thing and then doing one thing, and saying, hey, I can do that too, I think really helped people feel more confident in their skills as well.
That's great. Thanks. Yeah, I think that idea of using short videos, we've done that with HasWhopper and some other trainings as well. And it really does go a long ways having just, rather than just speaking or having slides, having videos of people in action, and sharing those. It's been really impactful. Well, thank you to the panelists for answering those questions. We're going to move into the Q&A section now, and I'll go back to Amy with Neha to start that.
Great, thank you, Kai. We do have a few questions queued up, but if you do have questions now, feel free to drop them in the Q&A box. The first question I have is, and all panelists feel free to raise your hand or just jump in to answer the question. In most of the incidents that I've been part of, wildfires, hurricanes, flooding events, local public health agencies have always lacked resources and expertise. As more federal agencies contract with private companies to assist in response, what can local and state agencies do better prepare to integrate these resources? Anyone from the panel want to take that question? I can drop that in the chat too, so you can see it.
So I'm trying to understand the question. Is a question about how to tap into resources that are provided by private entities?
I think so. Yeah, as more federal agencies contract with private companies, I think it's asking how to integrate these resources into the local state from private. That's what I'm understanding.
Yeah, I think an example might help. If it's a tool like, for instance, let's say a tool like Salesforce, which is used widely by businesses for information management and much more. That is one tool that during COVID, the California several state government entities started using Salesforce, and it was inordinately successful, and it's still here for information sharing and pretty much has become the main platform for requesting mutual aid and so on. So I don't know, I think Megan might be able to better answer how locals would be able to tap into that. It would also depend on, are you aware of that technology, that product or not, to start with?
I agree. I think in a specific example, I'm having a little hard time kind of understanding what they're trying to get out of this question.
Okay, if you can explain a little bit better in the chat or the Q&A, we can reopen that question up. But I saw Kelly, I think you had also.
Yeah, I popped in and I was reading that more as when EPA comes in, we usually bring with us contractors on the health and safety monitoring side or on the cleanup side. And I didn't know if this was questioned to getting more local resources integrated, or I think those are long-term set of contracts that the folks we use, and when they need to subcontract, we usually try and look at locals. But I would say from EPA's perspective, we really rely on local and state health departments to help us work with the communities. And I think just tapping into the incident command, tapping into any of the being integrated into the response, and then EPA can bring more resources to that. I don't know if you're looking for direct resources that would go to those groups, or just how to tap in. So I think, yeah, more clarification on that question.
Yeah,
Right.
the clarification, yeah, the example of Tetra Tech contractors bringing civil engineers to assist in wildfires.
Yeah, and those are contracts that are already in place. So, I mean, I would think if there are needs or questions that the states would want to use those contractors to help to answer, or there is additional needs, communicating those with the incident command to make sure they're getting addressed would probably be the most streamlined path.
Great, thank you, Kelly. Anybody else want to answer that question? Okay, moving on. The next question I have here is about, let's see, are states, counties, and municipalities able to declare emergencies due to lack of environmental health, public health professionals? If that is the case, then can we bring credentialed credential EH out of retirement part-time so they won't lose their retirement benefits, give them IT support and use their wealth of knowledge to benefit our local communities? I'm guessing this is a question if that's been done or if that's something that's happening. Open to anyone from maybe the local or state, Sada or Megan. Would you like to take that on?
I'm not aware of that declaration of emergencies being impacted by a lack of EH professionals. That has never really stopped a declaration from being issued.
Yeah, and I think
Thank you.
this gets at the broader question of how are we going to deal with these staff shortages in the short term and the long term?
Yeah, workforce and pipeline issues continue to be a concern. I don't know, some people are tackling it, going out to colleges, conducting job fairs and so on. We all talk about this. No one seems to have a magic solution to it, unfortunately.
And I'll also pipe in that I volunteer for EHAC for the Accreditation Council, and we're actively trying to recruit new schools to receive accreditation. We're really pushing that this year to try to add more programs so that we can be producing more professionals in the next 3 to 4 years.
Kai, I'm sorry, sorry. Kai, could you provide some information on that? I would love to know more about that.
Absolutely, I can put some information in the chat here. I'll let Amy keep asking the questions.
Thank you.
So something I've started doing, I don't want to say locally, but my husband's a teacher for high school. He was at middle school for a long time. And so as part of the California Environmental Health Association president also is I go and I actually talk at middle and high schools and at junior colleges. And I try and make myself really, really approachable. And it depends if I'm going to the middle or the high school level, which I'm going to do next month, actually. I bring like, it's Halloween, so I have like gummy spiders and stuff like that. And then I talk about, you know, rodent infestations and cockroach infestations. And to middle and high schoolers, that's a really cool thing. I mean, as a restaurant inspector, it's not, but it gauges interest from people. So kind of gauging your audience to bring something out in the profession that might pique their interest at that age is something that I've started doing over the last couple of years. So we'll see if any child I've spoken to takes me up on it, but I give them all my information too if they have any questions or anything like that.
Great, thank you, Megan. Next question I have, I think it's about expanding the topic of local RRTs, regional response teams or rapid response teams, and how to connect to them. Is that maybe a Chris or Kelly question? But feel free to anyone jump in on that one about local RRTs and connecting with them.
Yeah, this is Kai. I can just pipe in that it can be as simple as just finding out who is the head of your regional RRT and reaching out to that person. And then from there, Sada was also talking about the local committees. And I think just being able to make those connections, but you can start with the RRT, with the person. It's usually in your regional EPA office. And from there, you can get a lot of information and a lot of direction about what's going on with the RRT in your region. And Sada has also put in the chat here, you can find your local emergency planning committees pretty easily by Googling.
Thank you, Kai. I also saw Chris, you may have jumped into.
Oh, I was about to say, at least for the FDA wise, we do have a rapid response team program with states. They immediately jump in, such as train derailments right next to a farm, and if the grains within that train that might have fallen over or may have been contaminated with chemicals and things like that. And I don't know too much about the local interactions with the state for a state-run team like that. But the extent of where we usually interact would be from the state with the feds. But there has been time in the past where we've done trainings with local municipalities and things like that, and of course involve states. But it wouldn't hurt to ask to see how far we can get the ball rolling in terms of preparedness.
Great, thank you, Captain E. Our next question is around doing environmental damage assessments. Environmental damage assessment that is incident specific is critical in the early stages of response. Other than food-related resources, what else is available for locals? For example, air, water, structural resources. Most county agencies are ill-equipped to do these types of assessments, or they do not have staff trained to do this. Megan?
So we've actually gone through various iterations of damage assessment, and we don't have it as like a fire damage assessment or a flood damage assessment. We just have a general damage assessment and then different environmental health programs. If we know we're going out to an area that has a lot of wells or septic systems, then obviously that'd be the portion that we would focus on. And it's about sending those technical experts out there. So again, that kind of goes back to the whole training aspect of sending the correct people out there to complete those damage assessments. And I know when there are natural disasters, going through and requesting, when you go make those requests for people to come help for mutual aid, whether you need somebody that's in our AHS or somebody that has a septic background or anything, that's really important. So you get the right people that are doing those types of assessments.
Thank you, Megan. Anyone? Oh, Sada, I see your hand is raised.
Yeah, I wanted to point out that that is a recurring challenge for many local jurisdictions. I think in our state, we're relatively fortunate because our local directors of environmental health, the professional the community has a mechanism for bringing in retired directors to come and assist, who contract out to go and assist the local jurisdiction. But pretty much all local jurisdictions should be able to request mutual aid, but they have to know exactly what to ask for, of course. So wherever you are within your state or local system, there should be a mutual aid requesting system that you can follow. And our Cal EPA, our Environmental Protection Agency, very often has resources to send, to contribute, to be able to help local jurisdictions. And another resource I wanted to point out, the National CDC National Center for Environmental Health has a core of U.S. public health officers, including Kai, of course. I'm not volunteering Kai specifically, just to be sure, but they have offered their resources, and it's been an incredible reassurance that if we need to, we can tap in to that resource, everything from technical assistance to boots on the ground assistance for damage assessments and a whole lot more.
Great. Thank you, Sada. I think that's all the time we have for questions for today. Kai, would you like to close out for us?
Yeah, I'd just like to really thank our panelists and Neha for hosting. Really appreciate everyone and the in-depth questions as well. The chat was going the whole time, which we also really appreciate. And we'll make sure to transcribe, save the chat, and see what we can gain from going back and looking through that. But again, just want to thank everyone. And also to Sada's last point, there are resources, in particular, resources that are built on Survey 123 and Esri tools that we do have within CDC ATSDR that my office in particular and a couple of my employees work on. So that's something that we've had a webinar on before, and something that you are welcome to reach out to me about as well for those technical resources. And that has been something that's become more and more affordable with the way some of that licensing works. So I think there's a lot of resources that were offered here. I think we identified some gaps, but also some real strengths and synergies. And so I'm glad for that, and hope to continue this discussion offline with you all. And thank you very much for attending today.
Great. Thank you, Kai. Thank you, Kai. And as a reminder, a survey link will be sent after the conclusion of the webinar. So please take that time and fill that out. We really appreciate your feedbacks and comments and suggestions. Thanks again to all the panelists and moderator Kai, again, for taking your time to work with us today. We hope you enjoy the rest of your day. Thank you, everyone.